Hi everyone, welcome to yet another episode of Knowing Your Medical Maestros Beyond the White Coat. We are your hosts, Toti and Zippy. So we are joined by a very special guest at the Africa Stroke Organization conference, and I'll allow her to introduce herself.
All right, thank you. So I am Mayowa Opara. That's a very long name, so people call me May, and May actually stands for my three names. M for Mayowa, A for Ajoke, Y for Yinka.
Oh, I actually used to think your full name is May. I also thought her full name is May. Interesting.
Okay, so May is shorter and easier, and anybody can call it. So so I'm May Opara. Yep.
So May, we know you've come to the stroke conference.
Yeah.
Can you just give us a bit of why you're here?
Okay.
Does it have any relation to do with your specialty or anything?
Yeah. Okay, thank you very much. So I'm actually a neurosurgeon, and we deal with strokes just as well as neurologists and other health practitioners who are involved in the management of patients with stroke. And so this conference, helps to bring all of us who work in the stroke space together so we can share ideas and interact and see how we can give better care to our people and also prevent stroke. Yeah, so that's why I'm here.
Oh, that's why you're here.
Awesome. So how did you get into the journey of being a neurosurgeon? Is it something you knew all along you'd want to do?
Yeah.
A bit about that journey, how you started, into education, and how you ended up in that profession.
All right, very interesting question. So when I was in primary school, the first thing I wanted to be was a lawyer. Yeah, because I love literature, I love arts, I love talking. Although I'm changing a little now. And so I wanted to be a lawyer. But something interesting happened. You know how children can very easily change their minds because of something
Small.
Yeah. So my aunt said something about lawyers, and I was like, no, I'm not going to be a lawyer anymore. And the next thing that came to my mind was to be a doctor. All right, so I had that dream until I got into secondary school. In secondary school, I found out that I just fell in love with mathematics. I just began to understand mathematics in a new way, and I was so intrigued about it, and I told my people, I want to be a mathematician. And everybody's like, why are you changing your mind so frequently? And they all combined forces to ensure that I don't change and I stay in medicine. So my uncle then introduced me to a Ben Carson book. I'm sure we all know Ben Carson. Yes, exactly, Gifted Hands. And so when I got into university, I struggled a bit with the medical subjects, especially in my second year. Because then I was getting introduced to anatomy, physiology, biochemistry, and it was a little bit, not the normal thing that I know. And it didn't sound so interesting. I like to do things that I find interesting. I like to read books that are interesting. Anatomy didn't sound interesting. So that book by Ben Carson helped to encourage me to study. Because if you've read the book before, you would know that he mentioned that he used to be the dons of the class, and then his mother insisted on him reading books, and then from there he became like the best in the class. And so every time I needed to encourage myself to read, I'll read that book. And then when I got to year 3, for the first time, I found neuroanatomy so interesting. Neuroanatomy has to do with the brain, spine, It was so interesting, and I think that was when I caught the idea that I could do neurosurgery, right? And from then on, my thoughts about medicine changed. So much so that by the time I was in year 5, so medical school is a 6-year journey.
Yeah.
So by the time I was in year 5, I was almost sure that I wanted to do neurosurgery. In fact, what I used to say was, if I'm going to practice medicine, it must be neurosurgery.
That's
Yeah.
nice.
Yeah.
You sure you didn't get it from Carson because he's a neurosurgeon?
Maybe.
Calling you somewhere, but yeah.
Yeah, maybe. Yeah.
Okay,
Yeah.
that's very interesting.
Yeah.
So, May, maybe you could tell us a little bit of your journey in Nigeria now,
Yeah.
schooling in Nigeria.
Yeah.
Did you really experience any challenges? Just a bit of it
Okay.
from your primary to campus and now that you're practicing neurosurgery.
Okay, beautiful. So I was born in Port Harcourt, which is in southern part of Nigeria. I moved to Ogun State, which is in the western part of Nigeria, southwestern part of Nigeria, when I was 5. I lost my mom at that time, actually. So I was living with my aunt, her immediate younger sister. So if you hear me talk about my mom now, I'm talking about my aunt, yeah. So I spent 5 years in primary school. We're supposed to spend 6, but I spent 5. I don't know why. And then I wrote the common entrance into secondary school. I passed and I went on to secondary school. I did my secondary school also in Ogun State, but in Abeokuta, which was the capital city. At that point, my aunt moved to Ibadan. I'm sure you've heard about Ibadan. It's a popular city in Nigeria. Because she got married to her husband, who is the uncle that introduced me to Carson.
Oh,
yes. Yes.
Nice.
Yes. So secondary school, of course, 6 years. And then I wrote the JAMB exam. JAMB is the exam you write to be able to get into a university system in Nigeria. And I passed my JAMB exam and the SSC. We have 2 exams. The school living, or how like a secondary school certificate exam, which you write in all the subjects, and then the JAMB exam, which you write in some specific subjects for the course you are going for. All right. So I passed the SSC, I passed the JAMB, and I got into the University of Port Harcourt. Yeah, to study medicine. Yes, and I spent 6 years in University of Port Harcourt. After medical school, in Nigeria, medical school is an undergraduate training for 6 years, after which you must do a 1-year compulsory internship. After that, you do a 1-year National Youth Service Corps, right?
So you do it for 2 years?
Exactly.
Because in Kenya it's 6, 1, then now you can go into employment. So in Kenya we do have like 6 years med school, then 1 year internship, and then after internship you can get employed in either government or private depending on where you're working.
Oh, that's interesting.
There's no another second.
So in Nigeria we have that youth service scheme that has been around for quite a long time. So you get posted to a state outside of where you where you come from. Yeah. So for me, I come from Osun State, which is southwestern Nigeria. And I was posted first to Delta State, but I missed that. So I eventually got posted to Sokoto because at that time I had gotten married and my husband was in Sokoto. So I had to apply to get to Sokoto. Yeah, so they have that policy. You don't want to separate, couples. So yeah. So I did my NYSC in Sokoto, and afterwards I did my residency training in Sokoto. So yeah.
So what would be the most challenging bit in all that journey? The exams, the journey moving from state to another state. What would be said the most defining challenge that you experienced?
Ooh, I don't know.
Pick one that you feel like, oh man, it broke my heart or something.
I don't know, because basically when things happen, I put them in the past. So.
Oh, okay. That's a nice copy.
Yeah, so it's happened, it's past, it stays in the past. So I can't really pick any particular thing that I would say was so challenging. Well, maybe I can just share that when I got to Sokoto, of course, after the youth service program, that's NYSC, I had to wait a while before I actually got a job for the residency training. And then in residency training, the way we do it in Nigeria, we have two colleges that accredit our residency training system. We have the West African College, and then we have the Nigerian Postgraduate Medical College. Okay, so I followed the West African College pathway. Okay, I wrote the exam in 2007, and in fact it was because of that exam that I missed going for my youth service in Delta State. Okay, yeah, so I had to now shift it to the following year. So I wrote that exam and I passed it, and for me it was a way of acknowledging that yes, you should be a surgeon. Because
I know that was the right path.
yeah, it was like telling me that yes, you're on the right path. And that was really very good. And throughout my training, I've met with different senior colleagues who have inspired me in one way or the other. And during the training, I tried to think of doing other things, maybe just try and see if there's something else that would be more interesting. But no, neurosurgeon was the best. Neurosurgeon was the best, yes.
So what are like the highlights in your career? Is something that has really stood out for you in your practice, there are patient stories that really touched you. Have you worked on a conjoined twins or something like that? Maybe you can mention something that comes to mind.
Okay, so I think the one that comes to mind so easily is the one I presented today. Yeah, a young man who had what is called a caroticocavernous fistula, which is actually an abnormal connection between a major artery in the brain and a venous system in the brain. And so you have this high flow blood flow from the arterial system into the venous system, and that gives the patient a lot of symptoms, including having noises in the head. Some of his nerves to the eyes got weak, and he had a swelling on the eye that was, really bothering him. He started having blurring of vision. So it was really, really troubling for the young man. And he came to me, and, I was like, the best way to treat this is by the endovascular approach. All right, endovascular approach means you go through a vessel, usually in the groin area, but you can also go through the radial artery, that's the wrist area, and then you go with tiny little wires all the way into the brain, right? And you try to solve the problem through the vessels. And that is very interesting. It's relatively a new aspect of practice, of medical practice, relatively, compared to other parts of medical practice. And in particular, in Nigeria, we don't have it yet in full. I think it just started about 2 years ago in Nigeria. Meanwhile, I had encountered it in South Africa as far back as 2016. So I have really been interested in ensuring that we have that type of practice in Nigeria. So the good thing about this is that we're able to treat this patient in Nigeria, right? He didn't have to go out, and for me that's very, very good, because what it means is that patients who have conditions like this or other conditions that require endovascular treatment can have it in Nigeria. They don't need to travel anywhere, and that's helpful for them because it reduces costs for them and all of that. Yeah.
That's an interesting case.
Yes. Also, to add to things I've seen during my career, I told you I got married. I got married in 2007. So I'm 18 or 19 years? 18 years in marriage, yes. So for females who may be interested in going into neurosurgery or any of the specialties, don't be afraid of getting married. Just know what you want and ensure that your man understands you and support one another. It's very important. My husband is a plastic surgeon. And I remember when I was getting married to him, my aunt was like, I wish you had gotten married to a teacher. Who will be taking care of the children? Doctors, you're always away, But God has helped us. I mean, we have supported one another, and it has been amazing. When we need help, we ask for it.
Yeah.
So don't be afraid to ask for help when you need it. Yeah. And don't be afraid of chasing your dreams. Don't let the fact that you want to get married or you want to take care of children make you not go after your dreams.
I think now that we've known you and your journey and all that, so the whole reason why we do the Beyond the White Coat and knowing your medical maestros is to understand May beyond the white coat. So May, who are you beyond the white coat?
Thank you for that question. Remember I told you at the beginning that I wanted to do law and I was interested in the arts, right? I love poetry, music, dancing, acting. I love those kind of things.
You're multi-talented.
Yes, I love those kind of things. So I, of course, through my journey in medical school, I had to like cone down so that I don't get distracted. And I just stopped at music. So I love singing. And I'm going to sing tonight. So I love singing. And beyond just being a neurosurgeon, I sing in the choir. Actually, at the moment, I'm the assistant choir director in my church. So, so I love to do gospel music. That's what I really do. So I may not have a large repertoire of songs outside of gospel, but yeah, I love to sing.
Okay. So have you released any albums?
Yes. So while I was doing my residency training, I also decided to try and work on an album. And I did that and released it in 2017. Yeah, it's called Forever My God.
Okay.
That's the title of the album. It has 8 songs.
8 songs.
Yeah, in that album. Yeah.
So after album, have you released anything else? Do you have singles?
Yes, I have.
And collaborations.
Okay, so I've had a lot of singles afterwards. I've not been able to get another album, but it's in the pipeline. I'll get it working sometime soon. So I've released a lot of singles. I haven't really done any collaboration, and I think that's basically because I'm not a professional singer. I'm just doing it because I love to sing. Yes, so I haven't done any formal training in music, right? But I try to keep abreast and learn as I go. Yeah, so yeah.
Okay.
Oh, and by the way, I love to sing every time I go for a conference.
Yes, I do.
Amazing. So, it's amazing that you love singing and you have an album plus singles and maybe a collabo in the works. And we've had a guest on our show before, Betty Okere. She's a musician and she's a nutritionist, a dietitian nutritionist. And, she's able to balance that. She is a mom, she's a singer, she treats her patients and she runs her, her practice. So it's doable.
Yeah,
I love that. Yes.
So Betty, look out for May. Maybe you can think about going to Nigeria when she comes for an album.
I would love that. I would love that.
Yes.
Good.
So May, it's been really awesome having you at our show today. And we're looking forward to seeing you and sing at the gala dinner. So our viewers, please watch out for her. She's going to sing for us. I hope it won't be catheters and all that, but yes, she's going to have a very, very interesting song. And yeah, look out for that. And we will post her video at the end of the show.
Thank you.
Thank you so much for joining us. We are happy.
Okay, thank you so much for our viewers for joining us up until now, and we're excited to always have you following us. So look out for this video on our YouTube, Instagram, Facebook, Twitter, X, and we will keep it posted and give you more contents, this and better. So keep it locked. Thank you. So there you have it, our viewers. We have moved Knowing Your Medical Maestros to West Africa, and we are very excited to continue giving you more and better content. And we are happy that you're following us on our socials, on YouTube, Instagram, Facebook, X, Twitter. So keep it locked here for more. And this has been Knowing Your Medical Maestros Beyond the White Coat.
Your soul and the soul